I would like to continue the conversation about how nurses and doctors are trained to document in a way that makes patients look bad in case they go to court. These policies and procedures, the way that documentation is nowadays, isn't how it always has been. You see, over the last several decades, major corporations have been buying up your healthcare system. And they have been slowly changing the way that our healthcare system does patient care. And over the last couple of decades, as they've been buying up all the doctors' offices and putting them under the umbrella of like one major hospital, they were also fucking you over and training and indoctrinating their healthcare workers in a way that put them at odds with you, the patient. I know all this because not only have I worked in healthcare almost 20 years, my mother worked in the business side of healthcare for 15. She worked for a major hospital in a city that had millions and millions of people, and she was responsible for a department called denial management. And she would hound the insurance companies for money when they would deny their multi-million-dollar claims. She would often win, and she would come home with millions and millions and millions of dollars in checks from places like Blue Cross Blue Shield. My mother would share a lot of her knowledge with me, which is why I have a unique understanding of both the business side of healthcare as well as the patient care, because my experience is all in patient care. I worked for years, first in a GI lab, then in an ER, and then as a doula. I left working in corporate healthcare when I realized just how terrible it was, and instead left and started working in community care as a doula. And that probably broke me even more, if I'm being honest with you, because when I stepped out of the corporate nurse role and I entered into the role of community advocate, community caregiver, I realized just how much the hospitals have created systems to make it difficult for you to get any kind of adequate care. And that's not going to get better until we have a revolution, baby. Because right now we are the United States of corporate America. And it's time to get on board with the reality of our lives. Anyways, if you have questions about it, about my years of experience, or if you have questions about how the systems work nowadays, feel free to ask. But when I started working in healthcare, again, when I was 19, so almost 20 years ago, we didn't have computer charting. I mean, we had some, but all of our documentation was still written. So when I say that I have the plethora of experience in healthcare from almost 2 decades, I have lots of experience. Anyways,